Thank you for staying with us this morning right here on Good Morning Namibia. Now, poliomyelitis, also known as polio, is a contagious viral disease that attacks the nervous system, potentially causing paralysis. Children under the age of 10 from the Kavango East and West regions were vaccinated against polio. This comes after the recent detection of type 2 poliovirus in environmental surveillance by the Ministry of Health and Social Services. The campaign, which kicked off earlier this week on Monday, the 15th, will end today on the 18th of December, targeting all children under the age of 10. To enlighten us more, I'm joined virtually by Dr. Nguundja Uamburu, the Incident Manager for the Polio Event Response. Good morning, Doctor, and welcome to the show.
Good morning, Jemima, and thank you so much for having me. And good morning to the viewers.
Well, Doctor, to start us off, in response to the recent detection of type 2 poliovirus, the Ministry of Health and Social Services embarked on a special polio vaccination campaign, which started on Monday and will be ending today. Why is it that it's only the children under the age of 10 that are being vaccinated?
All right. Well, thank you so much for that question. Perhaps to understand this, it will help to explain a few basics about polio. So there are three types of the polio virus, type 1, type 2, and type 3. And for many years, Namibia, like most other countries, were using the trivalent oral polio vaccine, which protected children against all these three types. However, in April 2016, the entire African region switched from the trivalent vaccine to the bivalent oral polio vaccine, which protects only against type 1 and type 3. And this change was because type 2 poliovirus had not been seen globally since 1999 and was officially declared eradicated in 2015. So, for this reason, children born after April 2016 did not receive this protection against type 2 polio. So these children are now the most vulnerable, and that is why this campaign is targeting all children under the age of 10 to close that immunity gap and to prevent the spread of type 2 poliovirus.
Okay. And about 75 of the cases are asymptomatic, which means that they don't show any symptoms necessarily. In this regard, how can one protect children from getting polio from their asymptomatic peers?
Yeah, that's a very important concern too. So because many people infected with polio do not show symptoms, the virus can spread silently in the community. So the most effective and reliable protection is vaccination. Vaccination protects children even when they're exposed to the virus unknowingly. So this is why it is critical that every eligible child receives the vaccine regardless of whether they are appearing healthy.
Yes. And some do get flu-like illnesses or paralysis, and treatment then focuses on supportive care and rehabilitation. What are some of the measures when your child is diagnosed with polio that one has to take?
Yes, so unfortunately there is no cure for polio. So the treatment will really focus on supportive care, which may include now things like pain management, physiotherapy, and as you said, rehabilitation, and long-term support for those who do develop paralysis. That is why prevention through vaccine is so critical, because once paralysis hits, it can be permanent.
And the World Health Organization, in support of this campaign, has availed $2.1 million Namibian dollars. Where can children get the vaccines from? And why would you encourage parents to take the children for the vaccination, building on the points of protecting them from things such as paralysis?
So the children can receive the polio vaccine, through the health facilities, outreach points, and the door-to-door vaccination that is happening currently during the campaign period. The funding provided by WHO supports the implementation of the campaign, such as, payment of the vaccinators, transport, and other logistics. So, but then the vaccine themselves were provided through the Global Polio Eradication Initiative, which supports countries responding to, things like this that we're having currently in Namibia. So I strongly encourage that all parents and caregivers to ensure that children are vaccinated. There is no way that we can predict who will be exposed to a virus. So no parent wants or would want to risk that child becoming permanently paralyzed by the disease. So that is why it is really important that we we come to closing this gap, immunization gap, so that we can eradicate the polio globally. And every parent has to play a role. Absolutely. Because this disease is preventable.
100%. Now, the first group of children were vaccinated earlier this week in the Kavango East and Kavango West regions during the campaign's launch. What would you say were some of the challenges that were seen during this time?
The campaign is really progressing well, and really the teams and the healthcare workers on the ground are dedicated and committed. Some of the challenges are mainly logistical, including availability of vehicles and so forth. Because it's the rainy season, it affects road access and it makes house-to-house vaccination a little bit more challenging. But I would like to say that despite these challenges, the teams are working tirelessly to reach every child, and the communities are excited and very, but much engaged to get this vaccine. So the challenges have really been minimal, and there has been good support all around. Some things are things that we really cannot control, such as the rainy season. But yeah, so just mainly logistical.
Beyond the challenges, there are also considerations, especially for parents to take. Before taking the vaccinations, what considerations are there to keep in mind? And for children who were already vaccinated, perhaps with the older form of the vaccine, should they also consider getting vaccinated again?
Yes. So all children should receive the vaccine regardless of previous polio vaccination. As you rightfully said, the other one that was given, of course, it didn't have that prevention to type 2. So it is important that every eligible child gets vaccinated. The vaccine, however, is not recommended for children who are severely immunocompromised, such as those undergoing chemotherapy. So parents with such concerns should just discuss with the healthcare worker before the vaccination.
And how is the ministry monitoring the effectiveness of this campaign, and what indicators will show that the response has successfully contained the polio type 2 virus?
Okay, so at the end of the campaign, we will have, and also just after the campaign started, we have people called independent monitors who will be non-biased to the campaign, who are going now to visiting the villages at random and sampling them, and they will see, okay, were children actually reached? And the target population that we have, was it reached? So that will be, for now, the way we are monitoring the campaign to ensure that we reach our target for this round, because I would like to add that this is just the first round where we are focusing on Kavango East and West, but there will be a national campaign as well. Yes. So we'll be having those independent monitors. And of course, we've got a surveillance team that is quite effective to ensure that, they're doing testings to see if there are any more cases that will be picked up in the environment.
Yes, and I suppose does that form part of the long-term measures that are then in place in order to prevent future outbreaks?
Yes, yes.
Thank you so much, Dr. Uamburu. Before I let you go, in which ways can parents, caregivers, and community leaders support this campaign before it closes later today in order to ensure that every child is reached before its final closure?
Thank you so much, because really, honestly, the support from the communities are so important. So parents and caregivers should ensure that the children do not miss this opportunity. They should welcome the vaccination teams, as they've been doing, into their homes, and they should share correct information and discourage misinformation. Community leaders can also help by mobilizing communities, encouraging participation, and promoting trust in the vaccination process, because together we can protect our children and ensure that no child is left behind in this campaign.
Thank you so much, Dr. Uamburu, for those very comprehensive insights and for speaking to us about the importance of this particular vaccination campaign.
Thank you so much, Jemima, for having me once again.
The pleasure is all ours.